Okay, let's get right back to our conversation here with Dr. Owen Fonorow and meet our second special guest, who is also named Carol, and she is standing by right now. So, Carol, hi, welcome to the program.
Oh, hi.
Thank you for being here, dear. Why don't you just go ahead, if you would? We don't have a whole lot of time, about 10 minutes, and just get into your story. And Dr. Fonorow is here, and we'd like to hear what happened, what you discovered, and how these amazing products have helped you.
And how you got it. You talked to the co-author of the book, Sally Jewell, and how she helped you.
Oh, yeah. Well, it started in 2002 when I was diagnosed with cardiovascular disease and AFib. And I had all these cardioversions, and I had an ablation that didn't work, and then afterwards another cardioversion. And it just, nothing was working. And in 2006, my doctor decided he'd give me a nuclear test. So he did, and he found that my heart was just clogged up on one side. He wanted me to have a stent or a bypass, and he wanted to put me on statins as soon as possible. And I refused, because in the meantime, I've been reading about Dr. Linus Pauling's work and Dr. Raff, and I've read the books, and I wanted to try it. So couldn't get the Linus Pauling's protocol in Hawaii. I just never heard of it. And so I started taking 3 grams of vitamin C a day plus 2 grams of L-lysine and L-proline and whatever vitamins I could find that I thought would help. And I started feeling better immediately. It was like my feet weren't blue anymore, and everything seemed to be going good. I went to my doctor a couple times, and he says, "You're looking really good. Your heart sounds pretty good," except for the AFib. But anyway, about a year later, he ordered another nuclear test, and he at the day that I went in for the follow-up, the electricity went out in his building, and I had to walk from the garage up to his office. And when I got there, he said, "Oh, the elevators are working again." I said, "Nope. I walked from the garage up to your office." And he says, "You can't do that." I said, "Yes, I can. I told you I was feeling better." And I'd already found the protocol by then on the internet, and I'd been taking a Linus Pauling version for about 5 months. And anyway, he when we got into his office, he opened up my chart and he says, "I have really good news for you. Your heart is clear. There's nothing clogging the arteries. It's perfect."
Did you tell him what you had been doing, Carol? Did you tell him what you had been doing when he asked about this?
No, he asked me. Well, every time I went into his office, he says, "What are you doing? Because you sound so much better." And I said, "I'm just taking my vitamins," because medical doctors just don't believe in vitamins. And he's a good doctor. I didn't want to lose him. I didn't want to play doctor on him, you know.
I understand.
So,
yeah.
So I about 4 months after that, this May, I had the nuclear test done, the second nuclear test done October of 2007, and in May I had an echocardiogram. Now I'd had an enlarged heart all this time, also I should mention, and but when they did the echocardiogram, he said they found that all my arteries, my valves were working perfectly again. Plus, my heart was now down to its normal size.
Wow.
Which is unheard of, I guess.
That's incredible. The enlarged heart returned to its normal configuration. The valves were all working perfectly.
And the blockage was gone.
The blockages are gone. You know.
Now this must.
And my feet are not blue anymore. My feet are pink now.
Explain the blue feet, Owen.
I'm not sure I can. I mean, it's poor circulation.
Poor circulation in the feet. All right. Now, how long, Carol? Excuse me. How long did you take the products before you began to see and feel better?
I started feeling better almost immediately. I felt great.
Wow.
Which is reproducible, and anybody can try this. You don't have to go to the doctor to get a prescription. I mean, people can do this.
No, you just take it. I was just taking the maintenance dose. I was taking 3 grams of vitamin C a day plus the 2 grams, or whatever it is in that, what I call. I think it's a little over 2 grams of L-lysine and the L-proline.
Did you ever increase that? We've never spoken. Did you increase that, or?
I increased the L-proline a little because I was getting 2 messages, one from Dr. Rath and one from Linus Pauling. And Dr. Rath, he likes to have people. He likes to give more proline to people. But I didn't do it constantly. I was just taking that one protocol.
The Tower Heart Technology.
Sometimes I'd increase it, and sometimes I wouldn't, depending on how I felt.
How did you take it? Just mix it up in juice or something?
Just mix it in juice. That's all I took, and I mixed. No, I mixed it in water. It tastes like I don't know, sort of a sour orange juice.
Right.
Wasn't bad at all. It's very pleasant.
Briefly, Carol, what was the rest of your diet like? Were you doing the average American diet, or were you trying to do the right thing?
I didn't change anything. Nothing.
You're doing meat, cheese, potatoes, dairy, all that stuff?
I was trying to be good.
In other words, you said yes. That's right. I see.
I don't eat a lot of sugar, and I don't eat a lot of meat. I eat meat, but I eat more fish and chicken than I do red meat.
Well, it's still all got the same fat content. It's not any different. None's different than the other. What we're hearing here, Owen Fonorow, is that this is so powerful, and I do not recommend that anyone eat like Carol is. I just don't personally. I'm a vegan. It is so powerful, it can actually wade right through all this terrible abuse that most people administer to themselves by their diets and reverse the most catastrophic of human health problems, and that is a dying heart.
It is, and I've heard this now for 12 years from individual after individual after individual, and that's why we felt compelled to write the book, to share these stories, people using their real names. Carol's case is not even in the book. It ought to be. I mean, hearing it firsthand, it's unbelievable. And but it's over and over again. And so you're sitting in my position hearing this and wondering, how can cardiologists not notice this? Well, because the patients aren't telling them. They're afraid to tell them what's happening.
They're also beholden to a different God, shall we say.
Well, there are some out there. I mean,
there's some good ones out there, yes.
There are.
But most don't want to step out. They're worried about malpractice insurance suits. They're worried about many things.
They're they're controlled.
They're trained to do this. Their surgeons are going to send someone home and say, go take 3,000 milligrams of vitamin C a day and check with me in 6 months. It ain't going to happen. So they don't think like that. So you've been at it ever since, and you're doing fine.
Yes. I haven't quit. I'm going to do it the rest of my life, and all my relatives are starting on it, my friends at work, because they saw the difference in me. I went from just sort of plodding along like I was at death's door since 2002, and then this last year, I changed so drastically that they were asking me, what did I do?
Okay. Well, that's an amazing story.
I'm 70. I'm 70 years old, and I have a...
It sounds almost too good to be true, doesn't it?
You're 70 years old.
It's hard to sell because people can, if it's this simple, how come we all don't know?
Well, we're teaching them.
It's so simple.
Carol, you're 70 years old with a 50-year-old heart. Is that it, or a 40-year-old heart?
I don't know. I still have AFib. I'm going to work on that because I've heard people who are on the same protocol taking extra this and that for their AFib, and it's actually gone away.
Well,
and I have constant AFib. It doesn't bother me at all now that I have no plaque in my body.
I guess the question is, were you willing to share your approximate age? Are you willing to share your approximate?
70 years old, Owen.
I said I'm 70. I just turned 70 in December, and I went right back to riding my Harley.
Carol.
And I'm just a little woman, too. I'm not big.
Atta girl. What Harley do you have?
I have a Sportster 12,000.
Good for you. 1,200. Good for you. When you ride that Harley.
I'm I'm so nervous I can't think right now.
No, you're doing wonderfully. Well, this is amazing. She's riding her Harley, folks. That's just great. Carol, thank you. Maybe we'll have you back on again, and we'll explore this a little further. You've been wonderful, and thank you so much for sharing your story.
It's a pleasure. I just want to let everybody know that it's you can. I mean, God made a way to heal your heart. It's right here on earth. It's not in any bottle. It's not a pill bottle.
Good job. Thank you again. Okay.
Thank
Good
you,
night.
Carol.
Good night. This is incredible, Owen. You said something. We just have a minute left. We'll talk again maybe in 4 or 5 weeks, and maybe we'll bring both these ladies back. I mean, they're just amazing. This girl's 70 and riding her Harley.
Isn't it something? And if you think about her story, it's beyond belief. And we hear this all the time.
I understand. Well, I'm so
Thank you,
proud
Linus
to be able
Pauling.
to.
Thank you, Linus Pauling. Thank you, Linus Pauling.
Really proud to be able to help bring this information forward. But without you,
you're doing a wonderful service, sir, and we really appreciate it.
Last thing, you mentioned something about stem cells and the heart.
Well, the fact that the Harvard analyzed 880 substances to see if they could cause a heart stem cell muscle to regenerate into heart muscle. And only one substance was able to do that. And you want to guess what that is?
Amazing.
Vitamin C.
Amazing.
880 subjects. We have a pointer to that on several websites. You can read the article. Mm-hmm. Of course, it gets buried. You don't hear much about it. And we believe that is a large explanation why the EKGs become normal.
Yep. And the heart size in the case of the first Carol, or the second Carol, rather, return to its normal size. That's mind-boggling. Just incredible. This is.
We have stories of blood pressure. We have all these. It's unbelievable what happens.
We'll do that
what
more.
Clears up.
Let's get together next month. We'll do this again. This is so critically important.
Sounds like a date. I'm very happy to.
Thank you, Owen.
Thank you.
Good night.
Good night.
Please, dear friends, go and take a very close look at this. You heard some real truths tonight. VitaminCFoundation.org.